Hello, my name is Cece Chaplin, and I'm the co-director of the Healthy and Ready to Work National Center, funded by the Maternal Child Health Bureau of the Health and Human Services Administration. Today we're going to talk about the role of healthcare providers in preparing youth with special health needs for transition in healthcare. I'd like to introduce first the Healthy and Ready to Work National Center. You can see the map of the United States. We're a virtual center. Instead of planning the project in one center, we decided that we would take experts from around the country to provide information and resources for people about transition. So we're located in Minnesota, Washington, D.C., and Kentucky, and we have experts on family and youth, on care coordination, on planning for the future, and also on evaluation and research. The Healthy and Ready to Work Center has lots of resources that can provide for you because we've tapped into organizations around the nation that have been working in transition in healthcare. We also have Healthy and Ready to Work projects around the nation. They're located in Maine and Iowa and Mississippi. They've been in Minnesota and California and Arizona, several places, Wisconsin also. So it's very important for you to know that there's centers of expertise around the nation. We also work with the National Youth Leadership Network and CASA, Kids as Self-Advocates. And these are two organizations that have youth and young adults with special health needs and disabilities. And they provide information on their own experience. And they also are wonderful resource as advisors for policymaking and planning programs. So when you access the Healthy and Ready to Work National Center, you have access to lots of expertise around the nation. The major resource for you then to access all this expertise is our website at www.hrtw.org. There's a whole population of youth with special health needs that are here. They're leading productive lives. They're wanting to live out the same dreams that typical youth have. And that is why it's so very important to talk about transition in healthcare. Over 90% of youth with special health needs are now living to adulthood. Back in 1989, there was a meeting led by Surgeon General Koop to talk about the issues of these youth who are living longer and how we can provide the transition successfully into adulthood and not lose any continuity or integrity in healthcare. So what's really happening for youth with special health needs? In 1997, Shriners Hospital did a survey of their graduates. They've been working for a long time in transition, and they found that youth with special health needs who are graduating from their program into adulthood and adult care were not finding physicians that were familiar with their particular conditions, and also were not finding any kind of payment source for their health care needs. And even more importantly and crucially is that 80% of the graduates were not being referred to adult health care providers. Many were continuing with their pediatrician and their pediatric specialists. Also, many more were using emergency care. And as we all know, using emergency care is really not appropriate in maintaining continuity and integrity of care with special health care needs. So these are real problems for young people as they're moving into adulthood. There are other concerns that impact the life of youth with special health needs and disabilities around employment and education. We're finding that many more youth with disabilities are either unemployed or underemployed, and there also is a higher dropout rate. And this is why it's so important for doing some planning and some preparation for transition to adulthood. Well, transition is a process. Who among us is really not in transition most of our lives? But planning ahead and being proactive is extremely important. So what is this thing called transition? Well, it's the questions that we ask as we were moving from adolescence to adulthood, like, where will I work? Where will I go to school? Where will I live? Who will I marry? Who will be my friends? What kinds of fun things are there to do in the community? These are all the questions that young people are asking themselves as they're thinking about leaving high school and moving on into the community, further education, and jobs. So what does health have to do with transition? Absolutely everything. We all know that health has a large impact on employment. You can't go to work if you're sick. For youth with special health needs, it's the same thing. Also, what about living in the community? What kind of supports, what kind of things need to be arranged about where they're going to live? What about recreation? Are there some specific implications of their healthcare needs with recreation? What about planning for post-secondary, college, or further education? Can they live away from home? Where will they have their health care if they leave their home and the doctors that they have now? What about in home living, in community life? Where's the pharmacy? How do I get to the doctor? These are all things that health has an impact as youth are moving from adolescence to adulthood and living in community and getting more independent. As we're thinking about the impact of health on all the parts of transition, community life, employment, probably the biggest question of all is the youth with special health care needs ready to manage their own health care? We went back and talked to youth about what was the most important thing for them. In a survey by the National Youth Leadership Network of 300 young people, we asked what was important to you during transition, and their biggest concerns were, how do I pay for my health care, and how do I stay healthy? Another survey done with 1,300 youth in Minnesota, we also asked them about what was important for them in transition, and particularly in transition in healthcare. And they listed, they were most concerned about what to do in case of an emergency, what to do about healthcare, and what to do if their condition gets worse. When we went back and looked at some of the education programs, specifically one in diabetic care, we realized that none of those things were being covered as far as education for young people. So this was a very critical piece of information, and needless to say, things were changed in the education program. It's really important to go to the youth and find out what is it that they're concerned about as they move forward into adulthood. Let's talk for a few minutes about the issues for families. This is a very frightening, fearful time for families. They've worked for a lifetime to bring their young child along into teens and adolescence and into adulthood, worked hard to keep them healthy, and now people are saying, okay, it's time to let go. And it's a very, very fearful time. And of course, the major question for families is transition to what? Where are they going? Who's going to care for them? Who's going to do all the things that I've done for them throughout their lifetime? So it's very, very important for healthcare providers to start early with families. Once they're through the initial crisis and they can begin to look forward, it's very important to give them a sense of future, and that eventually this child will probably live longer and will have perhaps a very full life. And therefore, it's important to start early and thinking about how can this child participate in their care? What is ahead for this child? What will this child do when they grow up? So it's important to start early.
One of the things that providers could have done that would be very helpful is to sort of begin talking at, I would say, at the earliest age possible about transition planning, and talk with the consumer about what the plans for the future might be. Medical provider asking, what are your plans for the future? How prepared do you think you are to sort of manage your own healthcare needs? And are you taking your own medications, and how's that going for you? Those sorts of things that would sort of lead a person into thinking about plans for the future, that mom and dad or whomever may not always be there, so it might be up to them to take on more of their own care. And I think just having that discussion shouldn't be an issue of fear or concern that's placed on the person, but really just a nice, pleasant conversation about plans for the future.
Another important piece with families is also to keep their expectations raised and looking forward into the future. Let them know that there's a lot of things happening for young people out there and that they're living productive lives. Perhaps hook them up with other young people and other young adults who have gone through their special health care needs as children and now are living full lives. Give them a vision of the future. It's really important to support them emotionally in the letting go process. This is a critical time for the youth and the family, and it's very important to talk about their concerns and talk about what are the things that they fear the most and answer their questions. It's very important to also look ahead and think about what are the supports and resources that they're going to need for the future. Is this child going to be able to take care of themselves? And if not, what are the things that need to be set in place? Is it important to identify a health surrogate, someone who is going to be knowledgeable about the health care for that young person and be available for that health person to go to appointments with a doctor and perhaps help them organize for appointments and keep the records, the medical records together. Also, parents may need to think about, are there some legal steps that they need to take to provide the appropriate care for their child? And that is perhaps with guardianship and conservatorship. And these are two different things, and it's important to know that they're different. Guardianship, if the parents do guardianship means that parents are basically taking care of all the aspects of that young person's life, not only medical care but financial. It also means that they can make decisions about marriage, but they can't do it without their parents. It perhaps even means that as a result of guardianship that they can't even vote. So that's why a lot of parents think about conservatorship, where they choose the specific aspects of the young person's life that they want to oversee legally. I have conservatorship with my son, and I oversee the medical needs as well as the financial needs. Otherwise, my son can make any other kind of decision about his life. Families need help with creative problem solving. This is a time to answer questions about their greatest fears, talk about what's going to happen, talk about the implications, have the youth, of course, in on the discussion so they fully know and are accountable for any choices that they make as far as their care or as far as breaking any rules in their care or not following their care. It's a time to make mistakes and be able to learn from them and then try again. So creative problem solving and lots of discussion is very important at this time. The age of consent is also very important to discuss at this point. We've already talked about guardianship and conservatorship, but also for a lot of young people, this won't be an issue. But parents need to understand that in most states at age 18, young people are the sole signers of any kind of medical decision. So therefore, lots of preparation and turning over of care and decision making is important before that time. We don't want this to be a surprise. One way to turn care over to the young person is make them responsible for their medical records. And one way is a portable medical summary. We, in the Healthy and Ready to Work project, and it's on our website, have actually a form that is one page that includes all the information and health history that a young person has, and they can carry that in their wallet and carry them with them to the doctor, carry it with them to the emergency room, so it makes them accountable for their own medical information. Now we're going to talk a little bit about the issues for youth and the importance of the preparation for youth for transition. The first piece is informed decision making. A most critical part of transition, if it hasn't occurred before that, is that the youth fully understands everything about their own special health care needs and knows how to report information, how to communicate their needs, how to ask questions, how to talk to the doctor, how to arrange for appointments. All these things are very, very critical. In addition to that, learning about general health care needs is important. Oftentimes there's so much focus about the special health care needs that everything surrounds that, and it oftentimes people forget to talk about preventative health care. What does a young person do when they have a cold? What does a young person do for routine exams? What do they need to know about pap smears, testicular exams, physicals, and yearly physicals? What are the things that they need to know to keep themselves healthy like anyone else in the community? It's very important to be able to use other resources in the community to support this preparation for transition. And one important resource is the educational process and the individual education plan. It's important to work in coordination with the education team if the young person is in special education, because as they plan transition through the educational process, there's many things that the healthcare provider can let the educational team and the youth know about the impact of their health on the various pieces of transition like employment and education and so on. And along with this, they can use the IEP process, the individual education plan process, to learn about their health care needs. One way is to perhaps write a goal in the individual education plan to learn about their health care need. Perhaps they can make a report for social studies or for English. They can also take a look at what are the resources in a community where they hope to go to school, go to college, and they can do some of that research on their own. So these are some things that in working together with the education team that you can prepare the youth with transition and also put health care into the transition process. Other issues to talk about with the youth is also about healthcare insurance. As a youth leaves school and goes on into either more school or in employment, there's a transfer of health insurance. Many youth can stay on the parents' health insurance if they're full-time students or if their disability is very, very severe and they continue to live in the parents' home. And these are issues that families need to know about because they have to prepare ahead of time. Also, of course, they have access through Social Security in many states to use medical assistance or Medicaid. And now, in many states, there's possibilities to do Medicaid buy-in, which is a way to access all the services of Medicaid, but pay a small fee depending on the person's income. Another important piece for the youth to know about is the difference between the culture of pediatric care and adult health care. In pediatric care, of course, there's a lot more time to listen to the patient and address the concerns. In health care, it's very, very independent, and the person themselves really has to be very proactive, ask their questions, keep track of their medical information, and families and other people are not as included in the care. So this can be quite a shock when the young person moves from pediatric to adult. So a discussion about the importance of knowing about their own health care and being able to articulate their concerns and needs and being a good advocate for themselves is very important during transition. A final piece of transition that the provider can really assist the young person is that referral to an adult health care provider. Sometimes this is a challenge depending on the resources in the community, but certainly a discussion and the ability to be able to think about possible resources is very important during the transition process. It is time to move from pediatric to adult care. I just want to talk a little bit about the preventive care issue. As I mentioned before, it's really a concern that there's so much focus on the special health care needs that some preventative care is sometimes missed or put aside because of the concern and the crisis that occurs with special health care needs. But it's really important for health care providers to follow the routine care that they would do with any typical adolescent, and that is to focus on the nutrition, focus on the sexuality issues, focus on the concern of smoking or drugs, and follow up with the emotional growth of the individual too. How are their relationships going? How are their friendships going? Looking at the whole life of the individual. This is all part of just routine good preventative health care. Promoting self-advocacy is really important during healthcare transition. In my experience with my own son and also with many other young people that I've worked with, transition, as we said, is such a process and things change all the time. So part of self-advocacy is promoting good communication skills, helping them to learn to ask questions, helping them to be able to communicate their needs. Another part is creative problem solving. I found out that no matter how hard I worked to put services in place, things would change on a regular basis, and we were back at the same point doing creative problem solving again. So helping that youth to truly understand their healthcare needs and know how to do some creative problem solving, what are the resources available, who are the supports in the community, is very crucial during healthcare transition. So this is just a diagram of a model for healthcare and transition for youth with special health needs. In the past, we've usually put the family in the middle, and we certainly don't want to think that the family's not part of the process, but we really want to focus on the youth as the center of care, because they are the person that is eventually going to be making the very important decisions about their health care. Also want you to note that along with family and healthcare providers, we also have community resources as part of that whole team. And we'll talk a little bit more about that in a few minutes. So the partners in care, of course, are the families, and the youth are the leaders. They are the youth is in the center. The family is a very important part of the supporting system in this transfer of care. But along with that, of course, the physicians, the specialists, the pediatricians, the adult care doctors, also part of the team. And some of the issues that need to be thought of at this time is providing space for that young person to meet with you alone. And this needs to be done over a period of time. Transition for myself and my son happened in a matter of a few minutes, where the doctor asked my son one day if he wanted to meet alone with me. So I was really quite shocked, and my son kind of smiled, and of course he agreed to it. He thought that would be pretty cool. But that's not the way to do things, and it's very important to work with families and plan for this transfer of when you're going to be able to see that young person by themselves. And then also discuss about how then the communication is going to take place. Because families, since they've been such an intricate part of it for so long, they want to be able to at least get some information, but also respect the privacy of the discussion between the young person and the doctor. Also, during transition, it's important to think about your office, the accessibility, and also about the age-appropriate setting. You know, are the chairs too small for a young person to sit in? What are the changes that need to take place to provide a youth-friendly atmosphere in the clinic?
When I was probably around 13 years old, I was in a regular appointment with my mom. She was there with me. And a medical provider, I believe it was occupational therapist or something of that sort, had sort of taken my mom aside and actually taken her out of the room as I was going through my appointment and just talking with the doctor that was there. And I come to find out later in the day, as my mom and I were driving home after the appointment, that this person had spoken to my mom about obesity and the concerns about weight management and those types of things. And my mom had a really great response to the person that had taken her out of the room and had said, basically, I don't feed Julia. Julia feeds herself. She makes her own choices about what she's going to eat. We eat meals together as a family, but there's times when I'm not there, when she's making decisions for herself, and it's really important that you address this concern with her. And she was very respectful to this individual, but really turned it around to be that I was the focus, that I was the person that needed the information and to be spoken to. So I found that to be very respectful. My mom and I discussed this, and she found it to be very frustrating that people would take her aside for an issue that was about me and to me directly. And we have always made changes in that direction, that I am the focus and that I need the information.
In transition, as part of the team, community resources is very important, and this probably is a change from the typical team of care prior to this time. But community resources and knowing what's available is very, very important. As I mentioned before, working with the school, the team, this education team at the school can be a great resource, and healthcare providers can be a huge resource to the team as far as looking at the issues of transition. So it's very important to be well connected with the educational team in school. Along with that, there's vocational rehabilitation. Many youth with special health need may be able to access vocational rehabilitation to support their education, to support their job training. Being aware of this service is very important. And also looking at other community services. County social services can provide support for employment and for housing. Knowing what these are and being able to refer people and also understand about how these people work with a young person in transition. So community resources is a new and different member of the team during transition. So finally, I'd just really like to acknowledge the importance of the role of healthcare providers during transition for youth with special health needs. You provide insight and information for many members of the team that are assisting this youth to successfully transition to adulthood and living in the community and working and playing and living a full life. So as healthcare providers, you can work with education, support families, provide information for youth. So your role is really critical in healthcare transition. You're a very, very important member of the team. In closing, I would just like to again emphasize our website for the Healthy and Ready to Work National Center, www.hrtw.org. We have put together a site that provides lots of information and resources to make your job easier. There are a lot of tools that have already been developed to assist you and support your work in planning transition with youth. Assessment information, screening information, care coordination information. So please access the Healthy and Ready to Work website as an excellent resource for you as you plan transition and prepare youth with special health care needs for transition to adulthood. Thank you very much.